Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering emergency care nursing. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already, and be sure to check out my website, nexusnursinginstitute.com. I've got lots of resources available for you. I've got audio lessons. You can sign up for a one-on-one tutoring session. You can sign up for a consultation session where you could pick my brain about anything else, anything in the world. I can't speak today. Anyway, be sure to check that out, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, right here on YouTube. The handle is the same everywhere, Nexus Nursing. One more thing I want to say to you guys. I just recently found out about Super Things. I had no idea it existed. I didn't even know it was activated on my page. I happened to see an email about it. I'm like, okay, what is this? So of course, where do you go to get information? YouTube. You go to YouTube, and I just typed in Super Things because I wanted to see what this was all about. Guys, I did not know this for a little bit over a year. There's a button underneath my videos that says either thanks or super thanks, but it's basically if you want to send like appreciation gift to me, you press it. And I've been getting them, but I had no idea. So I'm just now seeing them. And so I don't want anyone who sent it to me, I don't want you to think that I was ignoring you. I just did not know. So there are too many for me to say thank you, but I'm actually going one by one under the comment section where someone sent a super thanks. I'm going to be saying thank you. It's going to take a while because I'm just one person, but I promise if you sent a super thanks to me, I am going to say thank you to you because I appreciate it. Anybody that shows their appreciation to me and what I'm doing, I'm so thankful and I'm so grateful. I think this is a great idea. Shout out to YouTube for even doing that, but I wish they would inform their content creators better because like I said, I had no clue. So anyone who sent me some super thanks, don't think that I was ignoring you. I just didn't know. But thank you from the bottom of my heart. Thank you for thanking me, and thank you for showing the appreciation for what I'm doing for you guys. So thank you, thank you, thank you. And I'm just very grateful to be in a position where I can share content with you and deliver it in a way that seems to be helpful to you guys. So thank you again. All right, guys, without any further ado, let's get started. Emergency care nursing. First question. Which is the treatment of choice for anaphylaxis? Would you say it's pseudoephedrine, antihistamine, epinephrine, or corticosteroids? Your patient comes into the ER with anaphylaxis. What is the drug that you expect to be ordered for this type of patient? Very good. Epinephrine. So guys, anaphylaxis is like having an allergic reaction on steroids, right? It's a lethal type of allergic reaction. And so epinephrine, which causes vasoconstriction, it's going to immediately bring that blood pressure back up. It's going to help with that patient that's having that anaphylactic reaction. Now, the other choices, we have pseudoephedrine. That's an alpha and beta adrenergic agonist, and we give that like for treatment of things like asthma, heart failure, rhinitis. The next option is antihistamine that blocks the H1 receptor. So we give that for, disorders associated with allergies. But remember, I said anaphylaxis, that is a lethal type of allergic. That is the worst type of allergic reaction that you can have, okay? So you expect epinephrine to be given. Now, something else you guys need to know about this. If a patient comes in with anaphylaxis, yes. Oh, sorry, I missed a choice. Corticosteroids. Two people chose corticosteroids. Guys, corticosteroids works against inflammation, so it decreases inflammation. So anyway, when a patient's having an anaphylactic, when they're having an anaphylactic episode, right? Yes, we expect to give the patient diphenhydramine, that's your Benadryl. Yes, we expect to give the patients steroids because there very well may be inflammation. But guess what, guys? That's an adjunct. That's medications that we're giving also with what? Epinephrine. But if you have to choose one medication to give to a patient that's having this type of emergency, which is an anaphylactic reaction, you're going to give them epi every single day of the week. Okay, Kloppy says can't see answers. I'm so sorry. I can't bring the camera closer. This is the, wait, let me see if I can. Okay. Is this better? All right. Which body system is most involved during anaphylaxis? Is it the gastrointestinal system? Is it the respiratory system? Is it the integumentary system? Or is it the neurological system? Which body system is most involved during anaphylaxis? Okay. 45 of you guys chose respiratory. And I know what you were thinking. I feel like you were thinking which body system is most concerning, which body system is most lethal when a patient's going through anaphylaxis. And if that's what I asked you, respiratory would be the answer because we're so concerned about that airway closing up and the patient can't breathe. But that's not what I asked you. I asked you which body system is most involved. And only 3 people chose the answer. And the correct answer is integumentary, where during an anaphylactic reaction, there's about a 60% chance of the patient having respiratory issues where, the airways closing up, that patient can't breathe. In almost every anaphylactic reaction, we'll see the patient either breaks out into hives, urticaria, or have pruritus. Pruritus is where they have itching of the skin, or urticaria is where they break into hives. Almost every single anaphylactic reaction, we'll see that. So, like I said, the body system most involved is going to be integumentary because you will see the integumentary system involved in almost every anaphylactic reaction. But if I ask you about the most deadly complication, the most lethal complication, the complication that we would be most concerned about, then the correct answer would have been the respiratory system. Okay. Oh, and neurological, that's rare. We really don't see like neurological symptoms such as, dizziness, stuff like that in the anaphylactic reaction. And GI, such as nausea, vomiting, those GI issues, we'll see that more if a patient has like if they have like a food poisoning or something like that, but not really during an anaphylactic reaction. What you tend to see most often, again, are these skin involvements such as pruritus or urticaria. All right, which symptom is most indicative of systemic inflammatory response syndrome, SIRS? Is it bradycardia? Is it bradypnea? Is it leukocytosis or hypertension? I forgot to put the N on hypertension. Which symptom is most indicative of systemic inflammatory response syndrome? All right. Most of you guys chose the correct answer, but a lot of you guys didn't even choose. Leukocytosis, an increase in WBCs. WBCs normal is supposed to be 5 to 10,000. So you'll see an increase in that number. So let's talk about, sir, systemic inflammatory response syndrome. That's basically an exaggerated reaction or response of the immune system. So you would see the heart rate go up. You would see the temperature go up. You would see the WBCs go up. So not bradycardia. If anything, we'd see tachycardia. Not bradypnea. If anything, we'd see tachypnea, right? Not hypertension. If anything, with that, the blood pressure we would see go down, not up. So leukocytosis is the correct answer. You see an increase in the WBCs. When you see systemic inflammatory response syndrome, I want you to think of the immune response, just an exaggerated manifestation of the immune response system. All right, which is not a trigger for sickle cell crisis? This is a medical emergency, by the way, if your patient's in sickle cell crisis. But which is not a trigger for it? Cold temperature, infection, metabolic or respiratory alkalosis, high altitude. Which is not a trigger for sickle cell crisis? Wow. 15 of you guys said high altitude. High altitude is a trigger. Cold temperatures. Remember, cold causes what? Vasoconstriction. Infection is a stress on the body. High altitude, what do you think happens to your oxygen levels when you get so high? All those three are triggers for sickle cell crisis. The patient who has sickle cell disease, you think they can go skiing in Aspen? They better not, right? But metabolic or respiratory alkalosis is not a trigger for sickle cell crisis. Matter of fact, being in an acidotic state, acidosis, that is a trigger for sickle cell crisis. And here's why. What happens is when the patient's in a acidotic state, it causes hemoglobin desaturation. So you know how oxygen latches onto hemoglobin. Hemoglobin's part of the RBC. And so that's how oxygen goes where it needs to go in the body to perfuse the tissues, right? What happens is when the patient's in the acidotic state, it causes the hemoglobin to release the oxygen. So the oxygen is not being transported the way it's supposed to, and it's not perfusing the tissues the way it's supposed to, okay? So acidosis is a trigger for sickle cell crisis, but not alkalosis. All right, you're discharging the patient with sickle cell disease. Which statement shows that they understand teaching regarding their disease process? Is it, I'll manage flu-like symptoms before calling the healthcare provider? Is it, I'll play sports in cold weather to avoid dehydration? Is it, when I'm upset, I won't talk about it? Or I'll carry a bottle of water with me everywhere that I go? Very good. I'll carry a bottle of water with me everywhere that I go. I'm so happy only 5 of you guys chose I'll play in cold weather to avoid dehydration. I worded it like that because what happens is many students, they will see one word. I was expecting you to see the word dehydration, say, whoa, 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 dehydration. We don't want dehydration. Let me choose that. But you got to read the whole thing. I'll play sports in cold weather? Absolutely not. In sickle cell, we don't want the patient to be dehydrated, correct, but we don't want them in the cold. We're going to teach them to always walk around with a water bottle, always take sips of water to avoid dehydration because dehydration can cause sickle cell crisis. Let's look at the other answer choices. The first one, I'll manage flu-like symptoms before calling the healthcare provider. Absolutely not. Any stress on the body, physiologically, such as an illness, or psychologically, such as stress or anxiety, that can precipitate a sickle cell crisis. So any stress on the body, the patient needs to know that they need to reach out to the healthcare provider immediately, okay? Next, I'll play sports in cold. I told you why that's the wrong answer. And then when I'm upset, I won't talk about it. No, because they're holding in all of that frustration or anger. What do you think that's going to cause? That's going to increase the psychological effect on that patient. And guess what? It could trigger or precipitate a sickle cell crisis reaction. So the only correct answer choice here is to stay hydrated. All right, your patient's brought to the ER with a spinal cord injury and they cannot move below the level of that injury. Why would an indwelling catheter be inserted? Is it because the bladder is areflexic? Is it because the patient cannot ambulate? Is it because the patient's experiencing involuntary bladder contractions? Or is it because hematuria and infection may be present? Why would an indwelling catheter be inserted in a patient that had a spinal cord injury? Okay, most of you guys chose the correct answer. The bladder is a reflexic. So that patient who had a spinal cord injury, they may lose that nerve, the bladder innervation, and not be able to sense when the bladder is full. Let me tell you something. That bladder ruptures, that is a medical emergency. It's not a question of if, it's when that patient's going to die if that patient's not taken into the operating room immediately. Okay. Ruptures of any organ is a medical emergency, and the patient has to be rushed to the OR. And we want to prevent that. It's always better to prevent than to treat. So that's why we're putting an indwelling catheter. All right, your patient comes to the emergency room with jaw pain, one-sided facial drooping. Which cranial nerve do you suspect to be affected? Do you think it's cranial nerve 6, the abducens? Do you think it's cranial nerve 8, the acoustic? Do you think it's cranial nerve 5, trigeminal? Or do you think it's cranial nerve 3, oculomotor? You guys are doing great on the live. Okay, very good. Most of you guys that got the correct answer, trigeminal. It deals with the face, the cheek, the chin. Then you have your abducens. That is what actually makes your eyeballs, what's the word I'm looking for? Rotate's not the word. Is it rotate? Move, rotate. Yeah, it makes it rotate outwards. Sorry, guys. 8 acoustics. What do you think that would be for hearing and also balance? And then 3 ocular motor, that helps like constrict the pupils, and it also helps with eye movement. But trigeminal nerve, that's your 5th cranial nerve. You guys absolutely need to know it. I want you to think of what? Trigeminal neuralgia, right? With trigeminal neuralgia, the patient will have pain with anything that may, uh, let me go back because I'm not wording it correctly. Things that can trigger the pain that the patient has in their face from trigeminal neuralgia, because that's that nerve, is anything such as a wind, that patient chewing, any cold draft against the patient's face, someone kissing the patient on the cheek, that patient even sneezing, right? Any movement can cause that severe pain. When we're talking about trigeminal neuralgia, I want you to think of that facial pain, because lots of students, they confuse trigeminal neuralgia with Bell's palsy. Bell's palsy, yes, the patient will have one-sided or unilateral facial drooping, but pain is not involved. If you see pain, we're talking about trigeminal, okay? Patient's not going to have that pain if we're talking about Bell's palsy. All right, a new admit has been diagnosed with temporal arteritis. Which of the following drugs would you expect to be ordered for this patient? Would it be steroids, anticonvulsants, muscle relaxants, or antihistamines? What do you guys think? Temporal arteritis. Okay, the correct answer is steroids. Wow, most of you guys chose muscle relaxants. Okay, so let's talk about this diagnosis, temporal arteritis. By the way, just a hint, whenever you see the diagnosis ends in itis, usually when something ends in itis, it means inflammation, right? Temporal arteritis, and here's your temple, okay? Temporal arteritis, it's a type of vasculitis. So the vessel, that vessel in your I can't speak. I just said it. Your temple, that vessel in your temple is inflamed. What medication do you give for inflammation? Steroids, duh, right? So even if at first glance you didn't know what temporal arteritis was, you should have noticed that it ended in itis. Something ends in itis, it means inflammation. What do we give when inflammation is present? Steroids. So the correct answer is steroids, but let's talk about this. We're giving the patient steroids. What are the 4 things we're going to be very concerned about because the patient's getting steroids? We're going to be very concerned about stomach ulcers because steroids are very hard on the stomach and cause the patient to get ulcers. That's why you give it with food. We're going to be very concerned about hyperglycemia. Steroids are very sugary. It can cause the patient to become diabetic, possibly. We're going to be concerned about osteoporosis. Steroids cause the bones to become porous. So we're going to be concerned about fractures. There's one more thing. Oh, the infection, because steroids mask the signs and symptoms of infection. It decreases inflammation. So you have to observe and assess your patient a lot more closer. A slight elevation in temperature can mean a massive infection, right? Because remember, steroids mask the signs and symptoms of infection. So you're going to be checking the patient's temperature a lot more closer. You're going to be looking at those WBCs. You're going to be looking at the ESR. You're going to be looking at the CRP. You're going to be watching out for signs and symptoms of infection in this type of patient. Which of the following would most likely be associated with a cluster headache? Would it be tearing? Would it be fever? Would it be aphasia? Or would it be epistaxis? Which is most likely associated with cluster headaches? $11 of you guys chose epistaxis, nosebleed. No, tearing. So cluster headaches, guys, this severe pain, guys, it causes unilateral or one-sided pain that the patient will feel like behind their eyeball or at the temple, right? And the patient will have it for several days to even several weeks, and then they'll go into like a remission where they don't feel the pain for a very long time, for extended amount of time, and then those symptoms come back. And so it's called a cluster headache because it comes back in groups or clusters. They'll have it for a cluster of days or even weeks, and then they'll go a long time without experiencing it, and then it'll come back again. That severe pain is going to be one-sided, unilateral. They'll feel it behind the eye or at the temples, okay? Something important else to know, the patient will have like tearing, they may have runny nose or congestion, but those 3 we usually see with the cluster headache, but absolutely tearing. Not fever, high temperature. Aphasia is when the patient has difficulty either expressing or understanding language communication, and epistaxis is nosebleed, but we don't see those with cluster headaches. All right, your patient overdosed on an alpha adrenergic antagonist. Which symptom would most likely be observed in this type of patient? Is it warm flushed skin, bradypnea, hypertension, or hyperglycemia? Only 3 people chose the correct answer. So guys, um, alpha adrenergic blockers or antagonists, they cause vasodilation. So with vasodilation, remember, when there's vasoconstriction, there's decreased blood flow. When there's vasodilation, there's increased blood flow. So we would expect to see warm, flushed skin. We would also expect to see glucogenesis. So we'd actually see the blood sugar go down, not go up. We'd expect to see increased heart rate, we increased respirations. Instead of the bradypnea, we'd expect to see tachypnea. So the only correct answer here, guys, would have been warm flushed skin, and we wouldn't see hypertension because, again, when we have vasoconstriction, that's when you would see hypertension. But when you have vasodilation, you'd see the opposite. You'd see hypotension. So with alpha adrenergic blockers or antagonists, knowing that we're seeing that vasodilation, the only correct answer is that warm flushed skin that we would see in this type of patient. I'm sorry, guys, there is a timer. You guys just can't see it because I had to put the camera closer to the screen because you guys said you couldn't see. Let me back it up for you. I'm trying. All right, your patient's admitted to the ER with with ingestion of an unknown substance. You assess your patient and you note bradycardia, bradypnea, hypotension, and meiosis. What substance do you think was ingested? Opioids, anticholinergics, sedative hypnotic agent, or sympathomimetic? Look at those signs and symptoms. What do you think was ingested? Very good. Opioids. What do we know about opioids, narcotics? They bring everything down, right? You're going to see the heart rate go down. You're going to see the respirations go down. You're going to see the blood pressure go down. Meiosis. Make sure you guys know the difference between meiosis and mydriasis. I'm saying that wrong. Mydriasis. So the one with the D, not this one, mydriasis, that D stands for dilating pupils. Meiosis is the opposite, constriction of pupils. So these signs and symptoms, the bradycardia, the bradypnea, the hypotension, the meiosis, which is a constriction of the pupil, we'd expect to see in an opioid overdose. Anticholinergics. Remember, anticholinergics can't see, can't spit, can't pee, can't, right? Can't see, blurred vision, can't spit, dry mouth, xerostomia, can't pee, urinary retention, can't, constipation. Okay, sedative hypnotic. Yes, it does bring down because like the heart rate, but it doesn't cause meiosis. And sympathomimetic, what do? They bring everything up, such as the heart rate, the blood pressure. So the only correct answer here would be the opioid. And we're down to our last question. All right, you're treating a patient that overdosed on calcium channel blockers. You're treating the patient. How can you tell that the treatment is actually working? Excuse me. Is it that their heart rate decreases? Is it that their temperature decreases? Is it that their glucose increases? Or is it that their blood pressure increases? What would be a sign that treatment is working for the patient that overdosed on calcium channel blockers? Very good. Blood pressure increases because calcium channel blockers, those are antihypertensive agents. So if a patient took too much, we'd expect to see their blood pressure bottom out, down to the ground, right? So as we're treating them and they're getting better, we expect the blood pressure to start to rise back up. And guys, that is it for this video, but there's so much more that you need to know for emergency care nursing. So if you're watching this video on YouTube, go ahead and in the comment section, let me know if you'd like to see a part 2. If you'd like to see a part 2, I will go ahead and prepare one for you. All right, guys, everybody that is doing this Kahoot with me live, let's see how you did.